For today, we have Madam Geetha Gopi, who's a rehabilitation practitioner and a psychologist. Ma'am is the and director of programs at the Sashaktikaran Trust, Cochin. She has over 30 years of experience in helping children with special needs. She's worked in international schools that has followed an American curriculum for inclusive settings for more than 15 years. Ma'am has done intensive work in curriculum development and adaptations, behavioral management, coordinating and promoting best educational practices using UDL principles among the staff and parents. Ma'am has launched the Early Academic Series, that is a teacher's kit for teaching early English language skills and basic math skills that is based on universal design of learning. Now, before I hand over the podium to ma'am, I would like to inform you all that the session is for 2 hours, where 1 hour would be knowledge sharing by the expert speaker, and the other hour is where ma'am would answer all your questions. Then, I would also like to inform you all that after 5 to 10 minutes, the chat settings would be changed to the host and panelists, and we would again change the chat settings to everyone during the Q&A. Over to you, Geetha ma'am. Wishing you all a very happy learning.
Good evening to everyone. I hope I'm visible, audible, everything.
Yes, ma'am, yes.
Okay, so today's workshop is on addressing children with special needs, addressing their unique challenges. So should I just go on to screen share?
Sure, ma'am.
Okay, so today we are going to have an overview on addressing the unique challenges faced by children with special needs, especially in under the purview of mainstream education and inclusive settings. So it is it'll be more of a brief outlay on what are the different kinds of challenges, what specific tips can help us, put these children into mainstream schools and empower them to be more successful, and how the different stakeholders can contribute to that. Okay, just a quick recap on the previous workshop you may have had. I'm sure you've gone through, the child development, the developmental milestones, the different areas or domains where child development takes place and unfolds, the different skill areas that are involved and that progress during child development, developmental delays, and what are the hitches or the hurdles that come into development in the form of delay or deviance or dysfunction, etc., which ultimately leads to a disorder or a disability. And I'm sure the earlier workshops have talked about the different kinds of disabilities or red flag indicators, which may signal certain kinds of, indicators that may be visible in children, which gives you an idea that they may be at risk, and therefore they need attention and they need to be remediated. So in the different types of disabilities, I'm sure you've gone through neurodevelopmental disabilities, physical, sensorial, and behavioral, especially with the early childhood, infancy to early childhood part. So today we are going to go a step further from that. Today we are going to look at types of disabilities that we see in mainstream school settings. So when children get to school, preschool and above, what are the most common disabilities that we see in the regular classrooms, and how do we go about managing them? And when we talk about managing them, we'll be looking at the different roles that different stakeholders have to play. That is the role of educators or teachers, parents, And then, of course, the school and the management, the school environment and the management, where, we have to set up an environment where these children can succeed. We'll also be covering the different kinds of, the special tips on what can be done to help in each kind of disability. Again, just to remind you, this is an introductory session to all disabilities that we commonly see in mainstream school settings. So we'll be touching and skimming through the wide range of disabilities, and in general talk about what to do. So we are not going to go into high specifics, but this is just to give you an overview idea about the special needs conditions we see in regular schools. So children with special needs, when they come across in regular schools, what do they come with? They come with certain issues. Many of them may have challenges that are far more than what a typical child faces in a classroom. And some of these difficulties may not just be present for some time; they may last a lifetime. So this is something we have to bear in mind. So therefore, they may need extra support or additional services to help them overcome these challenges to the maximum extent possible. And when we talk about extra support and additional services, they would not only include extra services in terms of in the academic area, but they may also need social supports, medical interventions, behavioral interventions, therapeutics, and so on. So there could be a wide range of additional supports and services that children with special needs may require in the regular classroom. When we talk about special needs in general, this awareness about special needs, came about with a lot of public litigations that were filed, particularly in US. And a lot of public litigations became public laws with regard to persons with disabilities and their rights and their services and so on. And then finally, an act called the IDEA Act, or the Individuals with Disability Education Act, was formed in 1997. So before it was even introduced, there were a series of legislations that finally led to the passing of this act. And since 1997, this act has actually undergone several revisions. And presently, the IDEA Act US requires every state in US to have in effect facilities and procedures which ensure a free, appropriate public education for all children with disabilities. And what this FAPE, or the free, appropriate public education, ensures is it is formed under the presumption that all children, even those with special needs conditions, are entitled to a free and public education to meet their unique needs and challenges and prepare them to become more productive, useful, and contributing members of society, whether it is in the field of, whether in terms of education, employment, independent living, and so on. So what are the commonly seen special needs conditions that we see in the regular classroom? I've kind of broadly divided them into under certain categories. Physical impairment is one, intellectual disability, autism spectrum disorders, behavioral disorders, and specific learning disorders. And under these umbrellas, there are certain conditions which are more commonly seen in regular classrooms, or people are more familiar, or come across more, are more visible in the classrooms. So we'll be touching upon a little bit of those as well. The good news, when we talk about special needs, one of the things we get is, oh, how do we deal with these challenges, or how do we provide for these children? What can we do to accommodate their needs and challenges within the classroom? The good news about children with disabilities is most of them are, even among the regular population, if you look at the bell curve of an IQ, majority of the children actually have average IQ. So, at least the cognitive, general intellectual quotient, many of them fall within the average or above average range. Yes, a small percentage of them do fall in the low average, borderline, or below average range. And therefore, they will need, more additional services, and, you may have to make more accommodations and modifications for them. But it is to be remembered that the heartening fact is that a lot of children with special needs and different kinds of disabilities, a majority of them actually fall 50% and above, actually fall in the average and above average range. So that actually gives us a lot of hope that we can actually do a lot for this population. So what are the initial markers and challenges? A lot of challenges in different domains. I'm sure with the child development workshops, if you've attended those, the different domains and the different challenges have also been mentioned. This will also be a quick brush through over those. Sensory motor challenges, especially, in the younger children or children who have, into preschool, you find a lot of these. There may be delay or deviancies in gross and fine motor development. There may be motor, sometimes there may not be an obvious motor a delay, but there may be small coordination issues. Sensory issues may be present. That is, the children may show an exaggerated or a very diminished response. That is hypersensitivity or hypersensitivity to certain kinds of lights, sounds, textures, noises, etc. So, different kinds of sensory motor challenges may be seen. Cognitive challenges, primarily, most of the most commonly reported challenges are, issues with attention, being able to arouse attention, sustain attention on a task, maintain focus and attention till task completion. Memory issues, being able to remember things learned over time. Organizational skills, time management, being able to categorize and sort, classify, understand similarities and differences between concepts. So all these helps in, all these are things which may be occurring in varying degrees in different kinds of disability conditions. Some of the other challenges that are seen are in the communication area. There may be some children may have difficulties in speech, verbal speech development, and it may range from being totally non-verbal to minimal verbal or totally verbal. Some children, those who may be verbally very eloquent, may have problems with pronunciation or following even receptive language, such as listening to directions, following, and so on, may be a challenge for some. Some of them also may have a difficulty in holding a conversation on a given topic. So sometimes the speech milestones may be there, but some of the pragmatic uses of speech and language, such as holding on a topic or holding a conversation, participating in group discussions, or presenting on a topic in the class, etc., may be a challenge. So all these can affect these kind of difficulties can be seen in children with varying special needs conditions. And then we also have the social emotional challenges. Some of them may have difficulty in peer group interaction. They may find it difficult to make friends and maintain friendships. So all the things that go with socializing, being able to speak to each other or communicate with each other, being able to hold eye contact, understanding gestures, body language, sometimes even humor. All these may, be challenging for some of the children. In addition, some of them may also have, things like may experience anxiety, fear, or low self-esteem, etc., when being in a group, especially in a regular mainstream setting, where they can actually see that other children are able to perform, things in a better or a faster way as compared to them. So this can cause certain socio-emotional challenges as well in children. And last but not the least, we also have the academic challenges, because again, when we come to school, we academic, development and performance is a big part of school environment. So the academic challenges primarily in three areas broadly, in reading, writing, and arithmetic. In reading, it can range from being struggling to read or having very halted, stuttered reading, or effortful reading, to even not being able to read or recognize or having trouble with letters, sounds, and so on. Some of them may read, but they may find it difficult to process the information and comprehend what they're reading. When it comes to writing, primarily two areas, big areas, that is, they may have difficulties with handwriting, that is pencil grip, manipulating a pencil over paper, etc. Then they may also have difficulties with expressive or creative writing, which is, being able to convey their thoughts and ideas and communicate that in written form on paper. So again, here a lot of things like spellings, grammar, sentence structures, etc. are involved. So they may face challenges in all these areas. Apart from that, some of the children may also have weak numeracy skills, which means having trouble with numbers, understanding number concept, poor calculation skills or logical reasoning that is associated with math, even poor math skills. Sometimes they may perform on paper very well, but poor functional math, that is having difficulties applying math skills or numeracy skills to real life situations. So all these pose great academic challenges, and this contributes to weak study skills, poor exam taking skills. And what it broadly what it does is even acquisition of academic levels as per grade levels, the required grade levels, and even performing, academic performance or output of that academic performance through assessments, evaluations, etc. All these get affected. So I've just given you a broad overview on the different kinds of challenges. So now we are going to go in for a quick poll time. So over to you, Shivani.
Yes, ma'am. I'll be launching the poll now. You can give them the instruction. The poll has been launched.
Yeah. So basically, I just have three general questions. There are options. You have to choose the best option. So first one, the question number one is the special needs condition.
We'll wait for ma'am to join us. The first question is the special needs condition that is most commonly present in regular classrooms. So I see a lot of you have answered. And the second one is academic difficulties commonly seen in irregular classroom settings. The third question, most common behavior issues seen in children with special needs that interferes with their academic learning in a regular classroom. So we have a few of you still answering. Yes. Okay, in another minute, I'll share the results with you all. We have people still answering. So I'll be ending the poll now. Most of you have answered. And these are the results that were shared by you all. Ma'am is here with us. Geetha ma'am, can you hear us?
An issue with the net.
No problem.
I think there was some
So
issue.
these are the
Sorry.
poll results, ma'am. If you could please
So,
share on the screen and the
has
participants.
the poll gone?
Yeah. The poll results are on your screen, ma'am, that people have done. So for the first question, the most commonly present in the classroom, most common special need condition in the classroom, and 30% have said intellectual disability, 8% have stated physical disability, 47% of them say specific learning disorder, and 16% say autism spectrum disorder.
Yeah. So I think the poll, the participants have kind of voted for the right one. It is specific learning disorder that is most commonly seen among regular, if you look at mainstream school settings. Yeah. And the second one, academic difficulties. Yes, the most common is, acquiring grade level difficulties in acquiring grade level. I think a good percentage of got it. One behavior that is reported, behavioral issue reported from the regular classroom is also attention related difficulties. Yeah, so that's good.
Most of them have.
So people do have the participants have a fairly good idea about, this thing that's happening. Yeah. So shall we move on then? So we go on to the different kinds of disabilities and their management. So we'll just touch upon the different kinds of disabilities that we see and how we are going to, address these issues. Physical impairment. And the physical impairment, we do see children who have visual impairment or VI. And broadly, we come across children who may have low vision, that is, some residual vision may be there in these children, and they may be using, glasses and so on. And then there are those who may not have any vision, which is commonly known as blindness. So it may include either of the two. And what it really means is the degree of impairment may relate to the person's ability to see and learn things and how that affects the child's life. So when they have visual impairment, there are certain challenges that are posed. And what we need to do for these children, especially when they come into regular classroom settings, is first and foremost, we need to enable them physical access, because of low vision or having no vision at all, they may require help with being able to physically access the school environment, and also with locomotion or movement, getting around the school environment. So they may need certain assistive devices or certain infrastructural, modifications, such as, being able to use a walking cane, having railings across the wall so that, they can hold and walk while they're walking in the school corridors and so on. Having textured flooring, like certain areas, certain lines where they need to walk on, those tiles can be textured or embossed or slightly raised, and so that they can feel those textures and walk. And especially when it comes to corners, etc., the texture changes. So that gives children with visual impairment an idea that they have to take a right turn or a left turn and so on. So many of these kind of infrastructural changes to enable them to physically access the school environment and enable their movement around the school environment may be necessary. When it comes to academic things, like materials, they may need large print books, especially if they have low vision. large print books, by increasing the font, using of or using magnifying devices to magnify the normal textbooks and notes, etc. That may be needed. They may be given, things on audio tape so that they can listen to the lessons, or if they are familiar with Braille or they're learning how to read and write in Braille, then the same content, academic content, should be provided in Braille. Electronically formatted lecture notes, handouts, text could be given, like, so that they could listen to them, and any kind of aids that we're using, such as posters, visual aids, such as pictures, posters, etc. Try and give audio or verbal descriptions of what you're showing, and possibly give them models or textured or tactile 3D models, which they can also feel, so that to compensate for the visual deficit, you're providing the tactile and the kinesthetic as well as audio input to compensate for the challenge they have. Even if they are, drawings can have the outlines of drawings can be raised line drawings, which is like the outlines of pictures can be embossed. So again, so that they can feel these and understand what the picture is about. So any kind of visual materials, you need to understand that they cannot access it visually. So provide for an audio and as well as a tactile and kinesthetic component to it. You may use Braille lab signs, equipment, labels on equipments, etc. In Braille, or if they're familiar with Braille, or use auditory signs as well. So, for example, if there's going to be a visual signal, along with the visual signal, give an auditory signal as well. So giving something that will make them understand that, okay, this is what it is supposed to be. Ensure good lighting in classrooms, especially with those who have low vision. Poor lighting in classrooms can affect their performances. So ensure good lighting and preferential seating. Possibly get them to sit at the front so that they can access the blackboard or seek help from the teacher, etc. more easily. The next physical impairment is hearing impairment, and this, just like visual impairment, it may some children may have a partial hearing loss, or some may have a total inability to hear, which we call as hard of hearing or deafness. So either it could be, some may have some residual hearing in them, some may not have hearing ability within the audible range. So again, in these cases, these children, remember, their auditory modality is the ones where they have challenges in. So therefore, we need to use other compensatory mechanisms to help them overcome these challenges. Nowadays, a lot of children have hearing aids, and some of the hearing aids are nowadays they're becoming more and more sophisticated. So many of them are very tiny. Some of them are placed inside the cochlea, so you can't even see it. There could be cochlear implants, and they may have a transmitter and receiver. And some of these hearing aids also come with a clip-on microphone, which can be placed on the teacher or the speakers, so that when the teacher is speaking, she doesn't have to speak loudly for the child to hear her. Just the microphone will carry it across. Also, with children with hearing impairment, try and ensure background noise in a classroom is minimized, because if there is background noise, it further makes it difficult for the child to pick up on what the teacher is saying, because they're not able to filter these extra noises and what the teacher is saying. And then you may have to repeat the questions clearly. Some of them, actually, many of these children do excellent lip reading, or they may be being trained in lip reading. So again, lighting needs to be good so that they are able to lip read you. You can also give written material on notes, etc., prior to actually coming to the class, before they attend the class itself, so that they can read up on it and be prepared. So when the audio lecture is going on, they have some idea because they've read up on it. Provide written materials to supplement all the announcements, like any auditory announcements, signals, the bell ringing in a school, etc. All these can be provided either with the written format or with the visual signal. So again, remember where the challenge is and compensate it using the other modalities. Also, if you're giving audio teaching or lectures, videos, etc., provide written transcriptions, just like you have subtitles in a movie. If you're watching a movie that you don't know the language of, similarly provide transcriptions at the bottom so that those who can read can actually read in addition to listen to watching the videos and audios. So some of these things actually help children with hearing impairment, and many of them definitely, it goes without saying, they will also need a lot of input from the speech and language therapist. So those goals may have to be incorporated into the regular classroom. Then coming to locomotor impairment under the physical disability category. Locomotor impairment is when they have difficulties with movement. So basically, it could be anything related to bones, joints, muscles, coordination, etc. And it can affect children's ability to walk, pick things, hold things, move around, run, etc. And again, a lot of assistive devices may be needed. Again, enabling physical access and, through the use of, ramps and such assistive devices may be required to enable physical access and better locomotion for these children. Cerebral palsy or CP is a very common, motor disability with a neurodevelopmental origin that is seen in some children. And these children, again, may have a difficulty to move, maintain their balance, coordinate different kinds of movements. And this may also include their, oral or speech muscles as well. So again, locomotor impairment, a child with CP may also have additional speech and language issues because of the motor coordination issues. And some of the children with CP may also have other comorbid conditions like intellectual disability. So what do we do for children who have, these locomotor issues? So enabling physical access, you may have to think of, providing ramps, toilets which are more suitable for children who are on, who have locomotor issues, providing lifts instead of stairs, even having a classroom layout where the child can walk in and walk out more easily. Probably have the classrooms on the ground floor where it is more easily accessible for these children. You may have to incorporate advice from the OT, the occupational therapist and physiotherapist in the case of, when you're program planning for these children. Use of computers, audiovisual aids for teaching and learning. Some of the times, even for responding, because of their motor limitations, they may not be able to respond in, through writing or through speaking. So sometimes, just touch oriented programs may be necessary, computer programs, which enables them to communicate and demonstrate their knowledge. Again, locomotor assistive devices such as walkers, calipers, wheelchairs, etc., to enable them in to get around the school building and better. Coming to the next set of disabilities, this is intellectual disability. Here, children have the most significant issue is they have problems with their general intellectual functioning, which is well below the average range. So because of general intellectual functioning is affected, along with that, adaptive functioning, all the adaptive skills such as communication, social skills, activities of daily living, gaining independence in these areas, academic skills and so forth. There is a general global kind of delay and difficulty in all these areas. And therefore, many of these children would require a lot of additional support and help in acquiring all the skills, age-appropriate skills in all these different domains. And the focus will be more towards, making them more adaptive to the environment they are living in. Down syndrome, a very common genetic disorder, which is seen under the category of intellectual disability. Many high percentage of children with Down syndrome do have intellectual disability as well, and one of the most easily identifiable because of their distinct facial features and other physical features. Down syndrome is also very commonly seen in regular classrooms, especially because Down syndrome, due to early intervention, are identified very early on nowadays, and therefore they tend to get services early, and are all many of them are mainstream nowadays as compared to 10 or 15 or 20 years ago. So therefore, it is very common to find children with Down syndrome in regular schools, especially in the primary classes. So what do we do for children who have this, intellectual, sub-average general intellectual functioning, along with other adaptive behavior deficits? The thing is, whatever we plan, we should actually plan in very, very small steps. So use baby steps when you're planning activities or planning goals. Start by breaking everything into a simplest, most vital components. So it should be a very, very small step-by-step training program that needs to be given to these children. They need a lot of repetition because of the general intellectual faculties being affected, memory, all these are difficulties that they will encounter. So a lot of repetition is required. Incorporate multisensory learning experiences, because again, multisensory learning enhances better learning, better memory. So therefore, if you provide things in multisensory learning experiences, and if there is more experiential kind of learning, they tend to learn better rather than the very traditional book, paper, pencil kind of learning that goes on in the regular classrooms. And also a lot of them, especially as they go into higher grades, many of them may need modified curriculum content, because some of the very abstract concepts that regular school curriculum may not be suitable or even useful for these children. So therefore, curriculum content may have to be modified to focus more and more on life skills, especially as they go higher up the grades, so that they can be rendered employable. And they can be more veered towards getting employed, staying employed, and moving more towards independent living. Another disability category that is commonly seen is in the regular classroom is autism spectrum disorders, which is characterized by impaired communicative skills, impaired social interaction skills. Some of them may show very restricted, repetitive, or stereotypic behaviors, interests, or sometimes very bizarre kind of behaviors, which may be difficult for us to fathom. They may also show a lot of sensory issues such as hypersensitivity or hyposensitivity to different kinds of visual, auditory stimuli like lights, sounds, touches, etc. So they may have difficulties with sensory processing, or may react in exaggerated or diminished ways to these kind of issues. And with autism spectrum, some of them, there's a good percentage of them who are high functioning. They may have general intellectual functioning maybe within the average or above average range, but there is also a sizable percentage of children with autism spectrum who have intellectual disability as well. So then you have to take into account that if their general intellectual functioning as well is impaired, then therefore they need more input, and you need to take into account the factors for both while planning programs. Some of the general tips for children with ASD is many of them have, they respond well to if you establish a clear structure in their environment. So have and follow clear, established, and orderly routines. So predictability makes these children more comfortable. So having a structured routine every day, like a daily schedule, really helps them. If there is going to be a disruption in the daily schedule or the normal routines, and whenever possible, provide advance warning and preparation, because then it prepares them to accept those changes more often. Otherwise, if it comes as a surprise to them, they may tend to, have a meltdown, or have find it difficult to adjust or adapt to that sudden change. So therefore, provide advance warning and preparation. This could be something as simple as, for example, you have your normal school day, but suppose you're having a medical checkup or a dental checkup happening for all students, and that is not a normal thing. Okay. So, but because you know it's going to happen, so maybe a week or two before, whenever you get this information, try and prepare the child that on such and such a day, this is going to happen, and include that in their, in their calendar. So giving them an idea that this is going to happen on this day actually helps them accept it better and be better prepared. Allow planning and practicing of communication strategies. Sometimes some of these children may be non-verbal, so you may have to think of alternative communication, such as picture communication, PECs, or and so on. Also, social routines. Again, have a schedule. They may have difficulties in a regular classroom with background noise again. So sometimes, they may need to shut out those noises. So use of earplugs or noise cancelling headsets, especially when they are in a loud, say a lunchroom or the school cafeteria, or the break times when they are in the playground and so on. Sometimes these things may have to be used. So allow them the use of these things. Provide a quiet area or a calm down area if the child really needs to have a timeout and calm down. Sometimes they may have a sensory overload because of their sensory issues. They may need to go into an area. So you can have a little calm corner in your classroom. In some schools, they even have something called sensory room, where the child can go into that room and just settle down, and there may be some visual or auditory stimuli which is very pleasing, like soft music, or very pleasing lighting, so that the child can go spend some time there, then calm down and come back. Sometimes it's not possible, but at least have a calm down area and train the child to go into that calm down area instead of having an outburst within the classroom. So that can help. Using visual schedules and graphic organizers. So when you're having a timetable, have it in visuals, like, so just writing the timetable down. If they can read, that's fine. But if you have it in pictures, that really helps. Even when you're teaching them any task, if the task is broken down into steps in the form of pictures and words, that helps them follow it better, step by step, rather than just giving auditory instructions. Allow the use of computers, especially for word processing, because many of the children with ASD do have limitations with physically using a pen or pencil and writing. So, they may have to move on to word processing and use of a computer, and many of them do respond well to that. So some of these things can help with children who have ASD. Behavioral disorders, some of the most commonly seen one is ADHD, or attention deficit hyperactivity disorder, which is characterized by hyperactivity, inattentiveness, and impulsivity. Impulsivity can be, they just start acting before thinking. So they could, just shout out the answer before raising their hand, or get into a fight without even reasoning out if there is a need for fighting it out. So these kind of issues can be seen. Oppositional defiance disorder. Some children can have irritable moods. They can deliberately be non-compliant and disobey, very consistently. So all these come under behavioral disorders. And a slightly more severe form of this is conduct disorder, which is more like stealing or extreme bullying, being very cruel to other human beings or animals, etc. So some of these behavior disorders also may be seen in many of the children, although ADHD is more commonly seen in most of the classrooms. And these ADHD may occur along with certain other special needs conditions. So specific tips, for children with behavioral disorders. Have again very structured classrooms, give clear instructions, make it very precise, simple and clear, no ambiguity, so that they know what to follow. Reward the positive behaviors, catch them doing the correct behaviors, and reward that so that you can shape up their positive behaviors. Many of them do need to get out of monotony and routine, or get out of their seat, especially if they have attention issues and so on. So allow for small mini breaks in between. Provide fair treatment for all. Children with BD, especially the ones who are impulsive or who have oppositional defined, they tend to question, especially if the teacher is very partial to certain students or not. And so it is very important to ensure that you treat everybody fairly, because a lot of times these children become the target and everybody accuses them of having started a fight, etc. Because it's more visible. They tend to react, but nobody brings it out that the other children may have actually provoked these children. So again, try to, if such a situation arises, listen to both parties involved and then provide a fair treatment. Use motivational strategies again, to get them interested in and more engaged in the teaching learning activities you're doing. You can also employ mindfulness techniques, use of yoga, etc. Any kind of strategies for stress reduction, relaxation techniques, exercising more self-control and self-restraint, anger management techniques. All these can be actively taught to these children to help them manage their own behavioral issues. And then some of the children with ADHD or CB, some of them may need medication from medical doctors. So in that case, if medication is being administered, do coordinate with doctors and, understand how it works, when to give the medication, if it needs to be given during school hours, etc. And keep a working relationship with the doctor, because it is what your feedback to the doctor is very important in adjusting the timing, dosage of the medication. That will actually help the doctor as well and the educator, to how to decide upon the best dosage, timing, etc. for the children. And many a time these children can, with when behavioral training takes place and their positive behaviors increase, many a time the medicines can be produced, tapered off, and stopped if possible. So for all this, coordinating with the medical professional is very important. And then one of the most commonly seen disorder, many a time it is identified and a lot of goes unidentified until they reach, say, high school, is learning difficulty, learning disabilities, more commonly now known as specific learning disorder. And this actually affects how a child processes information and learns. The process of learning, that is what is impaired. And the good thing with the learning disability is that most of these children, all of them have average, above average, or some of them close to average intelligence. So intellectual functioning is intact. But despite that, they may experience difficulties in reading, writing, math, listening and speaking skills. And quite often these are manifested as dyslexia, reading disorder, dysgraphia, writing disorder, or dyscalculia, that is math disorder. Many of them have, elements of auditory processing difficulties and visual processing difficulties. Auditory and visual processing disorders may exist even without having learning disabilities, but a lot of children with SLD do have difficulties in these areas with regard to auditory and visual processing. Some of them may also have developmental coordination disorder as a comorbidity, or something called non-verbal LD, which is more to do with motor coordination. The major motor skills may be present, but they may have little things like being clumsy and so on. So or being able to catch a ball if thrown. So these kind of things may be affected. And some of them may have difficulties with directionality or remembering motor memory, learning how to ride a bike, balancing themselves on a bicycle, and so on. So generally, again, with learning disability, a great part of it is usually with academic learning, and particularly a large percentage of SLD is with dyslexia, which is reading disorders. But having said that, because of dyslexia, a lot of areas are affected, and therefore it has a spilling effect into other academic areas as well. So specific tips for children with LD, use a multisensory learning approach. Again, they may have, as I said earlier, they may have difficulties in the auditory processing or visual processing or both. So when you use a multisensory learning approach, it can compensate for the areas where they're lacking, and therefore learning can take place in the other modalities. And other modalities can compensate for the difficult areas. Provide a very systematic, clearly sequenced teaching process, and teach processes, not just the content. Just teaching them the content of the curriculum is not enough, but how you're going to process that information. So for example, not just teaching a word is enough, but how do you decode that word? How do you use the sounds of a letter to decode any word that is given to you? So teaching them those kinds of processes is what is important. For example, if you read a passage, how are you going to understand the different details in the passages? Or if you study a chapter, how are you going to summarize the most important points from that chapter? So all this is our processes, and these processes have to be taught to the children and not just focus on the curriculum content. Also allow for a lot of accommodations and modifications in the curriculum, particularly accommodations. A lot of accommodations are required in how the children learn. Many a time, curriculum content may remaining the same. It is how they learn and how they demonstrate their learning which requires adjustments, which are called accommodations. So allow for those. Render psychosocial support such as counseling and guidance, because many of all these children have generally average or above average intelligence, so therefore they know they are struggling. They're aware of their struggles, and they may need additional psychosocial supports to cope with that. Initially they may be confused as to why they're struggling while other children are not, because they don't have a visible disability. This is more like an invisible disability. So explaining to them what the condition is, and how they can take help, and what are the different support systems that will help them to ensure better learning. This actually helps them to grow up to be more more emotionally stable individuals later on. And enhancing their self-awareness, to recognize their own strengths so that they can use their strengths to achieve more. And understanding where support is needed, where their difficulties lie, and what are the support systems or resources they can make use of to overcome those challenges. So again, all these tips really help children who have SLD. We'll just go through a few scenarios. I just explained in brief all the different special needs conditions. So a few case scenarios, and let's see if you can, make an accurate guess about what kind of special needs condition it's going to be. So case one scenario, Joseph is an 8-year-old boy. He's studying in grade 2. He has difficulties in class, and he's quite often out of the seat during class hours. He also faces difficulties with his reading, answers well orally, but has difficulties with writing answers on paper. Math lessons are really a nightmare, a real uphill task for him, and he really tries to avoid anything to do with math. So what special needs condition do you think it is most likely to be? I would like the participants to probably put in the chat box what they feel. Any answers, Shivani?
Yes, ma'am. So most of them are saying ADHD, dyslexia, dyscalculia, learning disability, autism, ADHD with LD, ADHD with dyscalculia, SLD with focus problem, ADHD and SLD is what is the major chunk of answers. SLD, possibly dyslexia and dysgraphia.
Yeah, that's very correct. So, from the description I've given, yes, this child is most likely, again, unless a formal assessment confirms it, we cannot say it is this condition, because many of these characteristics are seen in different kinds of disabilities. But yes, it more likely points to a child with SLD with having attention, ADHD issues or attention related issues. Yeah. And as somebody rightly said, the child could also have, high functioning ASD. Sometimes they are very good, they may have good verbal skills, but they may have difficulties in the other areas. So that is also a possible answer. Case 2, this is scenario 2. We are talking about Shifana. She's studying in 4th standard or 4th grade. She has difficulties with eye contact, very poor eye contact, has, very low tolerance to loud noises. So she shuts her ears when she hears loud noises, has difficulties with communication. Verbal communication is very limited, just, initiates communication only for her immediate needs. When she sees any strangers or unknown people, she would go and try and smell them. If she's frustrated, if she needs to, convey something, but she's unable to do so, she flaps her hand vigorously in front of herself. Academic performance is below average and requires a substantial level of support. So what special needs condition do you think it's most likely to be?
Participants say ASD, autism, autistic, visual impairment and hearing impairment, hyposensitivity, ASD with sensory, autism, ASD with sensory issues and hearing impairment, SPD. These are the responses that are there by our audience. ASD, autism.
Yeah, most
ADHD,
likely it is
classic
ADHD. Yeah, sometimes children who have other sensory processing disorders may also have these issues. Yeah. Hearing impairment to some extent, although, many of them, they're when it comes to loud noises, etc., sometimes they may have issues with those. So yeah, all the possible answers are pretty much bang on. So let's go to case scenario 3. This Seema is a student studying in grade 3, and she has great difficulty with remembering all the academic concepts she's learned. And according to the parents, all her developmental milestones had been delayed. She also has difficulties with social and communication skills, and is still dependent, on others for her daily activities of daily living, such as dressing, grooming, etc. So what special needs condition do you think it is most likely to be?
People have written intellectual deficit, GDD, global developmental delay, intellectual disability, LD, ID and GDD, intellectual disability, intellectual impairment, mental retardation, CP, cerebral palsy, global developmental delay, SLD. So a lot of them have given these responses, ID or GDD, learning disabilities with ASD, intellectual disability. These are the CP.
Yeah, it's most likely pretty much okay. It is most likely to be intellectual disability, or CP with intellectual disability and so on. SLD, it's some of the in SLD, not all the milestones are usually delayed. With SLD, that is the very demarcating criteria. Most of the milestones, almost all the milestones in SLD are usually bang on time. Sometimes they may have show a delay in speech and global developmental delay or intellectual disability. Almost all the developmental milestones would have shown some kind of delay or the other. And yes, the child is showing, universally in all areas there are difficulties. So yes, it's most likely to be intellectual disability. So management, we are coming down to the management. I've already given you specific overview on tips on how to handle the different categories, but this is more to do with the educational setting and how do we go about, helping children, those who present these kind of challenges within the mainstream school setting. So when we look at mainstream school setting, we need to go for holistic management. So that is the physical environment. We talked about enabling physical access, locomotor issues. Apart from that, we should also think of, having flexible seating options. So different children may require, some children can sit on the floor, some may need very soft cushiony seating, some may need hard kind of seating, some may need to alternate between different kinds of seating. So, having a classroom setup which has different seating options help. Having quiet zones, calm down areas, or if you are having, a math center, a language center, and so on, designated areas in your classroom for different academic areas, all these kind of things help. Structure and routines goes without saying almost for everybody, not only children with disabilities, even those without these. Having clearly established routines in your classroom, responsibilities for the teacher as well as the students, consequences if they don't adhere to the rules, routines, and responsibilities, all these need to be clearly stated and conveyed to the students and implemented upon. So having a good a structure in your classroom. Systematic and positive academic learning environment. So, use combination of different kinds of teaching and learning strategies. Engage the students more actively so that they become more active learners and not remain passive listeners in the classroom. And use materials that cater to the different kinds of learning diversities that different special needs condition present in your classroom. So again, providing for, providing for and catering to the diverse needs. And then because many of these children may come with already established disability conditions into your classroom, they may already be receiving therapeutic services, etc. Or once they come into the classroom, they may need additional support services. So, you need to incorporate the inputs from these learning support systems, such as remedial education, which may be provided by a special educator, implementing different kinds of accommodations and modifications into your curriculum, getting input from the speech and language therapist, occupational therapist, physio, medical doctors, etc., depending upon what the challenges are and which other professionals are involved. Take their inputs and incorporate that into your classroom management, implementation, and planning out your education goals. Then last but not least, giving good rapport and having a good rapport and communication between all the stakeholders, that is the parents, the students, and the other professionals or supportive professionals who are involved. So it is a mutually beneficial working relationship that needs to be enhanced, so that when you're in constant communication and have a good rapport, each of the stakeholders can help support each other's efforts, and ultimately it will benefit the child. And when we talk about all this, the principle, the philosophy that encapsulates all this, all these things that I've talked about is called UDL, which is Universal Design of Learning. And what UDL does is, UDL is a philosophy, it's a framework that is an alternative to a very standardized, one size fitting all model. So we are not giving one curriculum and expecting every child to fit into it. We are providing other alternatives. So UDL is about having flexibility within your curriculum, the way it is delivered and so on, and giving the teachers as well as the students multiple options at curriculum delivery. And what it does is it removes the barriers that children with special needs challenges have in the regular classroom environment, and it makes the curriculum accessible to all children, irrespective of the conditions they have, irrespective of the disabilities or challenges, or irrespective of their strengths and weaknesses. That is, it caters to all the. It takes into account that there are diverse learners within the classroom, and therefore, before the children come into the classroom itself, the framework is such that it caters to as many diversities as possible, expecting those diversities to come into the classroom. And what it does is it encourages instructors, educators to provide all learners. And this doesn't just include special needs children, it includes even children, other children, the regular, so-called regular children, with multiple pathways to successful learning within the classroom. And it the framework tackles the thing at three main pillars, which is called, one is representation, that is providing the curriculum content in multiple formats. Action and expression, that is giving the learners multiple ways of expressing or demonstrating what they have learned. And then engagement, using different kinds of engagement methods for motivating the learners through the use of diverse materials, use of diverse learning strategies, making adjustments to your classroom environment, making adjustments to how you deliver the lessons, and so on. So UDL actually is the framework which actually sets the stage for mainstreaming and better inclusion. And when we come to this, the role of teachers, I've already spoken a lot about this, so I'll just skip through, this quickly. Get all the stakeholders involved, take input from parents, from the other professionals, and so on. Also, you give your tips, what you find works best with the child within your classroom. Convey that to the other professionals, convey that to the parents, so they can make use of this. Communicate what, whether it is academic or behavioral goals in all this, what works well with the child. Provide the activities, home-based activities for parents, which they can use to reinforce the skills that you're already teaching in the classroom. And also, give parents an idea about how they can incorporate these skills into their daily living environments within the home environment, so that even application of skills, because many of the special needs children do have difficulties with application. So, to minimize those generalization or application issues, give certain kinds of activities, information on this to parents, so that they can incorporate it into their home environment. When it comes to parents, well, set aside time and energy and effort for your children. Be your child's advocate. Don't hesitate to go up and ask or convey or talk to the professionals involved, whether it's teachers or other professionals. Feel free and communicate well what works well, because just like the teacher can communicate, you can also communicate what works well with your child. Keep understanding your child's changing needs as the child progresses. So according to the needs, you may have to think of different placement options, or you may have to think of changes in the kind of services being provided, especially with the learning support systems. The accommodations and modifications may need change, and so on. So keep understanding your child's unique needs, their strengths, and keep yourself updated as per the changing needs and challenges of the child, and work collaboratively with all the other stakeholders. And remember, a parent is a child's best advocate. So, your influence is paramount. And then when we talk about regular mainstreaming, remember that is not the be all and end all for all students. Depending on the severity of the condition, depending upon how the curriculum, progresses across grade levels, at different stages, you may need to review different placement options. So it may range from, from general education with minimal support to, having a general education and some special ed supports or other learning supports. It may proceed to more restrictive environments, such as, having pull-out special education services for a small part of the school day. Some children may even attend, regular school for part of the day and special school for part of the day. Some of the children may require special classes, completely for the academics, and maybe for non-academic areas they can be mainstreamed. And with the very, the kids who have very, very high challenges, sometimes they may need, special schools or homebound schooling, residential schooling, or daycare, day special schools, and so on. Again, remember, it is very child-based, depending on the progress of the child, their strengths and weaknesses. That is how we review placement options. There's no hard and fast rule, and no child stays at one placement tier all their life. They can move. I mean, sometimes a child starts off in mainstreaming very well, and as the grade level curriculum gets higher and higher, they may need to move into more specialized services. Sometimes it's the other way around. Initially, they may not be ready and they may be requiring some amount of special schooling in therapeutic and learning input. And then, when they are reasonably ready with support, they can move into mainstreaming. So it depends on each child, and this has to be reviewed from time to time. So when you're giving placement options, there's no hard and fast rule that once a child is in mainstream, they will remain in mainstream, or vice versa. If the child is in a specialized setting or maybe in a partial special school, regular school setting, they will remain there all their time. So this diagram actually shows, how far you should move and how far, how quickly the child should be mainstream. As much as possible, our aim is to mainstream them and make them more inclusive members of, pave way for greater inclusion, not just in the schooling years, but for life. So sometimes it does happen that during the schooling years, some bit of segregation may be necessary for certain children, so that in later on life, they can move into greater inclusive environments. I'm talking of children, for example, if they have, if say in high school, they're having great difficulties and they're not able to cope with the general curriculum. So they may need to move into, say, more vocational oriented curricula, those kind of things. So they may move out of our mainstream schooling, probably into a vocational setup, learn the trade and so on. But that is to prepare them for more independent living and greater empowerment and pave way for their community inclusion later on in life. So again, viewing mainstreaming and inclusion should be a lifespan approach and not just limited to the schooling year. So a variety of placement options have to be explored. So helping children succeed in mainstream schools, just a quick recap on all that I've said: create a positive learning environment for children with all kinds of diverse learning needs, build an ongoing holistic understanding of the children and their needs, always complement high quality teaching. You may have to have different kinds of learning groups, such as small group, one-to-one interventions, or regular large group teaching. Provide all the support systems that are necessary as per the changing needs of the students. And with this will include remediation, therapeutics, accommodations and modifications, etc. So basically, we have done, what we have done is try and understand different special needs conditions, understanding a basic of, how UDL can be provided, specific tips that will include and promote better UDL, and then harnessing, other professionals and parental involvement and support in contributing to, the child becoming more and more successful in an inclusive environment. So I come to the end of this session today. I'm ready for question and answers.
Thank you so much, ma'am. It was an enriching session. I'm sure the audience would agree with me. There's a lot of takeaway from your session, and it's rightly said that the collaborative effort between the parent, school, and the teachers can help the child succeed. Yes. So before we move on to the question and answer session, there are a few things that I would like to inform you all, dear attendees. Ma'am, could you please stop sharing your screen?
Yeah, sure.
Thank you so much. So now I would like to inform you all about our upcoming events. If you feel that these sessions are benefiting you, please share it with whomever you feel could benefit from it as well. So now on the 30th of September, we have the identification, assessment, and intervention of special students in mainstream setting by Ms. Gina Bermudo at 4 p.m. India time, 5:30 p.m. Indonesia time, and 6:30 p.m. Singapore and Philippines time. After that, on the 7th of October, we have the session on The Heart of an Educator, that is by Dr. Amba Sethi. It is at 4 p.m. India time, 5:30 p.m. Indonesia time, and 6:30 p.m. Singapore, Philippines time. The links are being posted in the chat box. Pre-book your slots, and we shall see you at the sessions. Now, let me take you through the platform as to how you could register for the workshops, have a look at the resources, as well as pour in your questions. So the step one would be, you can log in as you're seeing at the login tab, or you could see the option register for the event to sign up or register for the workshop. Next, what we would do is when we move ahead after clicking it, we will have a lot of tabs there at the events section. So you'll have the event details, questions, resources, and the related events. So when you click the questions tab, you can type out your question for the expert speaker. So while you're registering, do drop in your questions that would be answered by the expert speaker. The questions with the most upvotes will be prioritized. Then next we move on to how you could find the relevant resources of the workshop that you have attended. So in the resources tab, you can find resources that have been created by the ability team and the expert speaker for you. So do like, comment, and share the resources if you found it to be helpful for you. Then we move on to how you could also have access to the other events that are coming up. So if you click the related events tab, you can find the related workshops to the one that you have just registered. Then once you can go to that event and you can click on the registration, you get the link and we see you all at the workshop. So you can find all the workshops that you have attended and registered for at your events page. So if you could see here, the My Events tab will help you to keep a track of all the events that you have registered for. Do book your slots and we shall see you soon at the events. Now, we would move on to the question and answer session. Geetha ma'am, are you ready for the first question?
Yeah.
So the first question is by Miss Rosie, who wants to know that how can we as an individual know that the child is ready for a mainstream education? How a child with special needs is now ready for mainstream education?
Basically, what we look at is, if you look at, if you have a good assessment, you can have a good profile of the child, whether it's academic skills and so on. And what are the support systems that are available in the mainstream school that you're going to put the child in. So when you look at, try to match the child's strengths and weaknesses through the assessment, and then get them into the schools. And remember, when you put them in the schools, see what are the facilities that the school is providing. So for example, if a child needs special educational support, put the child in a school where there are special educational services being provided. And then, and usually most of the good centers where they do assessment, they actually give a recommendation of a good placement option. The level of challenges that the child have and the possible placement options is usually mentioned in the report. So that gives a good indication about what the child can achieve. And as I said, again, it's not a hard and fast thing. A placement option is always fluid. So when the child progresses and we find that the child is ready for, has certain, if you're going to put the child in, say, KG1, what should a KG1 child have? So at least if the child can, be able to sit for this much amount of time or communicate basic needs, need not be verbal, but at least can communicate basic needs, then you can consider putting the child there. So again, the support systems are very important. So you have to understand that a good assessment will give a good profile of the child and whether that matches with the grade level that you're going to put the child in. So that is where how you decide whether the child is ready for inclusion. And sometimes I can tell you it is also a trial. Sometimes we put the child, it may not be like, okay, I'm going to put the child in a regular school instantly, a whole day. Sometimes we even do it in a very tapered fashion. So it may be just 1 or 2 hours initially in a regular school so that the child gets acclimatized to that environment. The rest of the time, the child may be either attending clinical services or, therapy sessions and so on. And gradually you can increase the amount of time the child spends in a regular classroom. So again, as I said, it is all about being fluid and flexible.
So rightly said, ma'am. We have to match the child's strength and see if the child would be a best fit for the mainstream setting. Additional to that question, ma'am, there's a participant named Marikil who wants to know that will having a shadow teacher be helpful? Will a shadow teacher be allowed in the classrooms?
Shadow teacher, see, again, it depends on child to child. If the child actually requires a shadow teacher, then yes, having a shadow teacher will help. Because sometimes what happens is, especially with children who have, say, autism spectrum disorders, some of these children may find it very difficult if they do not have one-on-one support within the regular classroom. So in such cases, a shadow teacher is warranted. But again, there is no, general prescription that a shadow teacher is required for every child. It depends on what the child's challenges are, what are the expectations in the classroom, even the classroom strength. Now, in a regular classroom of, say, 30 plus or 50 plus kids, definitely the child with, challenges may need extra support within the classroom. So shadow teacher may be required. Whereas if that same child is in a classroom where the classroom strength is just 15 or 20, the regular teacher may be enough, or maybe with the use of peer buddies and so on, they may be able to manage and cater to the child's diversities. So again, it depends on what the environment the child is going in, the kind of challenges the child has, and whether the child requires a shadow teacher or not.
Thank you so much, ma'am, for this insight. Now we have a question by Ritu Vinod, who wants to know that what are some of the major challenges faced by teachers in mainstreaming children with special needs?
Uh, One of the major challenges that I've talked about, one is, many of them may not have awareness of the different kinds of disabilities and the challenges they pose. Especially some of the, a lot of the disability or special needs conditions, many of them are visible, like the physical disability is very visible. So, most people can kind of at least have an idea, okay, this child has difficulties in this areas. Intellectual disability, again, just by interacting with the child, that child is simply not as mature or as able as the other children. Most of the the disabilities are pretty visible. Therefore, at least knowing that the child has a problem is acknowledged. And then what is needed is greater awareness regarding the condition of that particular child and what the child needs. So, having awareness about the condition is important. Here I would like to mention that probably specific learning disorder is what is least understood, although it is more widely present in the classrooms, because it's not a visible special needs condition. It is more of an invisible condition because the children are seen just like any of their peers, but it's mainly manifested when it comes to academic learning. So therefore, they tend to be misunderstood or even not understood at all until the much later years, or when they really start falling behind or failing in their academics. So again, raising the awareness of teachers is very important. Collaborating with other professionals is important. The school support, the school management, how much are they willing to provide these kind of, the physical infrastructure that is required for those children, the kind of materials that are required, all the adaptations and the specific tips that I talked about with regard to different special needs conditions. How far is the school environment, school management providing, willing to provide, or the teacher willing to make these kind of accommodations and modifications to cater to the diversities of the children. So this is, I think, primarily this is what is required. If you have the mindset, if you have the will and the mindset, then the other things will follow. And also being a team player, work with, other professionals and parents.
So true, ma'am. One of the major challenges that teachers face is lack of awareness. And when the teacher has the will to help these children, and that barrier gets overcome. Now we have another question, ma'am, by Ms. Ravneet Kaur, who wants to know that children with special needs go through a lot of stereotyping and mocking by their peers. Can you suggest any tips how to make a child emotionally strong?
Yeah. First of all, again, providing awareness. So when as a school, we are including children with special needs conditions, it is imperative that everybody, all other students, those who don't have this condition, all students, all teachers, all support staff in the school, whether it is clerical, administrative staff, cleaning staff, whoever, everybody who works in the school environment, they all need an awareness about the different special needs conditions. At least have a broad overview of, these children are there, these are the challenges they face, and therefore they need these kind of supports. So spreading awareness actually helps in better acceptance and accepting the strengths and challenges that these children have. So again, not just portraying their challenges, but also understanding that many of them have greater strengths. So giving those our children, greater platforms for showcasing their strengths as well. Also, get them to especially as our children grow up, getting them to understand and accept their special needs condition, especially if they have the cognitive ability. With intellectual disabilities, sometimes it's a bit difficult, but again, even there, the children with mild intellectual impairment can also be trained in this area to understand what they can do and what they may have challenge and therefore need additional support with. But most of the physical impairments and disabilities, many of them already know, especially as they grow, they know what their issue is, and therefore you will find most of the physical impairment people are the most vocal. The visually impaired people, the people with hearing impairment, they are usually the more vocal people in advocating for their self-advocating for their rights. But here again, the specific learning disorder is where I find, they are very reluctant to accept and their disability. So a lot of, and especially if it is identified at a much later age. So therefore, it is important to convey to the children what their challenges are and how it is okay to take additional supports systems to help them perform better and be more enhance their performance, whether it is in the school setting or otherwise. So making them aware of these things and getting it. So that is why we say counseling and guidance services and these kind of support services have to be provided. Also within the classroom, having peer buddies really help. You can allocate 1 or 2 peer buddies to certain children so that whenever they need support, they can look to these peer buddies to help them out. And that not only helps the child with special needs, but it also helps the other children to, to empathize with these children, to understand them better, to forge greater friendships and so on. So all this together actually enhances better inclusivity.
So rightly said, ma'am. Psychoeducating the child is very, very important. At the same time, building on the child's strength is the key. So now we have another question, ma'am. It's a case-specific question by Ariane, and the participant states that they have a child in the classroom. The child's attention span is low. The child cannot answer the questions directly. He repeats the words when asked. There's low frustration tolerance. But the problem is that the parent does not recognize anything wrong with the child because the child is performing well in the online classes based on the grades. Can you suggest any ways on how can we convince the parent to get him checked so that he can learn better and improve on his deficits?
It's a hard battle. Very honestly, it is a hard battle. Again, what you can do is, as an educator, you can convey to the parents that academic grades are not the only indicators of a successful person. It is just one part of the entire plethora of skills one needs to have. So if the child has difficulties in other skill areas, if not in the academic environment, even later on, once the child is out of school, or even when the child gets into, say, high school, where they have, when they get into teenage and, pre-adolescent, adolescent stages, where they will have, social relationships, greater friendships, going out with friends. In all these areas, it's going to affect the child. So, giving the parent an idea about, as the child grows, it is not just academic grades that is important, but, development in all the different areas as well. So only if there is a holistic development in all the domains, that's when a child becomes truly successful in life. Grades are not the only indicators. So again, it is constantly trying to educate the parents on these issues, provide written materials, provide videos, or hold parent awareness workshops. It may not be for just this parent, but for other parents as well. You can even have, you don't need to just focus on parents of children who have special needs conditions. Have regular parent training programs in school where this kind of awareness is given out, so that even for regular children, there is a lot of focus on just getting academic grades, but that is not the only thing that is required to be successful in life. And in today's changing environment, even more so, it is important to develop other skills, other soft skills in addition to academics.
Very rightly said, ma'am, that holistic development is extremely important for any child. There's a question, ma'am, by Miss Vinita, who wants to know that we have all spoken about early intervention and state it to be the key for helping children better. How young can children be assessed by a trained professional?
It depends on what kind of disability. See, when we are talking about all special needs conditions, there are some that can be identified even prior to birth, because nowadays you have a lot of prenatal testing in expecting mothers. So things like genetic conditions like Down syndrome, for example, all these there are regular tests carried out in expectant mothers, especially if they are high risk parents. If they are above say age of 35 years plus, or if they have other health issues which we know may lead to children having some kind of developmental disabilities. In such cases, there are a lot of prenatal screening that goes on. So if it can be identified at that stage, then definitely there are precautions that can be taken. At birth itself, there's something called APGAR score, which is done, and certain conditions such as Down syndrome, for example, when the child is born itself, most gynecologists, pediatricians, neonatal pediatricians are aware, because the facial features, etc., are very distinct for these children to be identified, especially if there are visible physical characteristics. So right then you can identify and you can start, the child can be assessed. At that point, maybe the delay may not be noticeable, but you can start stimulation activities so that the delay may not set in or may be minimized. So at that, as early as that, you can start. And when it comes to things like, say autism and all that, maybe the motor milestones may not be affected. But once it comes to social skills like, eye contact, social smile, speech and language delays, again, the thing is, watch the child as they grow. If there is some kind of delay or deviance, take the child for an assessment. Many parents decline or differ from doing that because they think, okay, my child will be branded as disabled. That's not the case though. All you're doing is, okay, there is a delay, let me find out. And quite often the professionals, when they assess, they would tell, okay, we find a slight delay, maybe you can do some stimulatory activities to see if the child will catch up or not. If the child is not catching up, that's when more detailed assessments or more intensive interventions will be given. But whatever it is, the child will be getting what the child needs to get, the kind of early support. So as early as possible is what I would say.
Thank you so much, ma'am, for this wonderful insight. Adding on, as we have spoken about indicators like as early as possible, Joseph Lua, a participant, wants to know that what are the indicators to know when a child with special education needs is not suitable to continue developing in a mainstream school setting and instead should be referred to a special school setting?
Again, here it is, it is based on what the grade level expectations are, how much the child is benefiting from the grade level grade level curriculum. What is, if the child has been assessed, what is the diagnosis? Because again, if a child has intellectual disability and the child is, say, for example, I'm just citing an example, say the child is sitting in 8th grade doing maybe grade 1 level math. It doesn't make sense, right, to keep that child continuing in that setup. So maybe that child can then be integrated for non-academic activities, and for academic activities, you may have to, think of more functional oriented math for that kid. So again, it depends on child to child, and which is why I said, it is ideal for every year for the child's progress to be evaluated to see how much the child is benefiting from the regular ed setup. What really happens is, if the child is benefiting from the mainstream setup, then the child will progress. But if the child is facing issues in the mainstream setup and is requiring more and more of special education services or other additional services, then that is an indicator perhaps we need to rethink where the child needs to be placed. This is exactly why I talked about the placement model option. The least restrictive environment. But in the name of least restrictive environment, we shouldn't be putting the child in a place where the child is not being enabled at all. So it is striking a good balance between the least restrictive environment and enabling the child to, viewing inclusion as a lifelong approach. So maybe for such a child, you may need to remove the child for the academic areas into a special school and just have social integration in the non-academic areas in a regular school, and probably work on their pre-vocational and vocational skills, so that later on the child can, move into an employment and, become a contributing member in society, which will lead to better inclusion, rather than retaining this child in a regular mainstream setting and then after a few years finding out the child hasn't developed neither in the regular mainstream curriculum nor and has missed out on gaining certain other valuable functional life skills. So again, it's a choice and it has to be reviewed. There should be fluidity in placement of options. And I reiterate this because a lot of times educators as well as parents, once their child is in mainstream, they refuse to pull them out and consider other placement options. Or sometimes the other way around. They are very fearful of getting into the mainstream, from a special school setting where they're protected environment. They're scared to put their child in a regular environment. But again, here is where the parents need support. They need awareness. They need proper guidance from professionals onto, that inclusion has to be viewed as a lifespan approach, as a long-term approach. That is a long-term goal. So even if we are segregating or pulling out the child somewhere in the schooling years, it is for a better inclusion at a later stage, right? So, that has to be explained properly to the parents, and, they have to, hopefully they'll take it on. And also our school system has to be more flexible as well, because nowadays a lot of schools don't allow that kind of a flexibility, where the child can attend part-time regular school, part-time special school, and so on.
Thank you so much, ma'am, for an elaborative answer where it's important to give the right kind of support and environment with a collaborative effort to the child for helping them succeed. Now we have a question by Safna Sabri, who wants to know that will children with special needs always be dependent on others even after they have matured, or can they be self-dependent as well in the later years of life? What's your take on this?
It is a broad area. Special needs means which disability, what is the extent, the severity of the challenges that the child faces, how much of intervention did they get, how much have they progressed with this, with all the support services they have got. So it depends on each condition, on each child. It is from case to case. See, what happens is, there are people with physical disabilities. If you give them the right kind of, uh, the education and so on, they go on to great heights in the academic sphere or in the vocational sphere, but they may still have certain challenges in the physical area. So again, it has to be viewed in that manner. They may not have globally challenges in all the areas. So if they have challenges in certain areas, that may improve, but those challenges may not be totally overcome. Having said that, it depends on how well they're able to adapt to that. I mean, children with specific learning disorder, for example, I mean, they may have reading disorders. I'm just giving an example, dyslexia, for example. They may have struggled through their entire academic, schooling and college life with reading. But then once they get into an environment where, or to a vocation where not much of reading is required, or whether if they can use a software to enable them with reading, they can be successful individuals. So it depends on what we define as being independent, because if you look at each of us, even our so-called normal human beings without disabilities, we all have our shortcomings, right? So we try and overcome those shortcomings in certain ways. That is how it needs to be viewed. So even with special needs conditions, their shortcomings can be remediated and masked up to certain levels as much as possible. Our aim is to get everybody as independent, close to total independence as possible, and it may vary from case to case.
Yes, ma'am. Each child is unique in their own ways and they take their own time to become independent. As we had discussed about the example of learning disability, ma'am, there's a question with regard to it by Pratibhan Govindswamy, who wants to know that children with learning disabilities do have many challenges and difficulties, but how far will the modification of curriculum help them with development?
When we talk about curriculum modifications, there are two main aspects. One is called accommodation, one is called modification. Modification is when the content of the curriculum itself is modified. So, for example, if your class is learning two-digit addition, this child may be learning single-digit addition. So the content is modified to suit the ability of the or the challenges of the child. There's another aspect where the content is not modified, but you accommodate. You give in accommodations, that is how the child learns it, how the child demonstrates that ability, how the child performs in an assessment, that is modified. So the child may still be doing, if the rest of the class is doing two-digit addition, this child may also be doing two-digit addition, but may not be doing it as mental math like all the other children or using fingers. Instead, this child may be using a number line, or maybe using counters, or maybe in higher classes, maybe using a calculator. As long as the child knows this is how you go about solving it, but for the deficits that he or she has, maybe using a supportive device. So there you're making accommodations. So it depends on what the child needs and what accommodations and modifications you have to give. Again, as I said, this is case to case. So there is no blanket thing that helps every child. If you say extra time is needed for a child who requires more time to produce the answers, but still can do it in written format, you give extra time to that child. But for a child who has ADHD, giving extra time doesn't help, because that child already has a difficulty sitting for the required amount of time. So there you need to modify it. You need to probably give it in, give little mini breaks in between and give the exam. So this is what is required. When we talk about, modifying curriculum and all that, it is catering to each of the diverse needs that the children have and planning accordingly. And this is where the UDL really comes into force, because in UDL, for all the children, you are making multiple formats available. So if a child can't write, the child doesn't have to have a disability. If even otherwise a child has problems with writing, then okay, the child can give oral answers, or the child can, do a word process. So depending on children, what their needs are, you can modify make necessary accommodations and modifications as and when required. And again, this, like the placement model, this is fluid. As the child progresses in skills, learns so many things, or as the curriculum difficulty increases, depending on that, accommodations and modifications may have to undergo changes.
Thank you so much, ma'am, that as per the child's need, we give and provide the modification and accommodations. Now we have a question by Hazelin Parent, who wants to know that is it okay to orient other children in the class that a particular student is a child with special needs? Will it help or will it backfire?
Normally it doesn't, because actually that helps. Giving greater awareness, it is how you give the awareness that is important. Just telling, okay, we have so and so child, and that doesn't help. This has to be a constant program, especially in schools which are, because nowadays more and more schools are becoming inclusive in their approach. There should be ongoing programs for awareness creation among parents, among staff, among educators, among other students. So, even showing them videos on different kinds, or even with very young children. Nowadays, you find a lot of animated videos explaining different kinds of disability. So even showing them that, helps them understand what conditions the other child has, and therefore being empathetic to them and being supportive of them.
Teaching children to be empathetic towards their classmates is important. And now, as we are talking about the classroom scenario now, there is a participant, Abhishek Khandelwal, who wants to know that how can a teacher make the classroom environment conducive for both children with special needs and also a neurotypical child?
I've already mentioned everything, I think, through the talk, all the different, the ideal approach. So basically that is the framework. And when we talk about all this, again, I always reiterate, we are not doing anything extra or special for children with special needs. In fact, they are for all kids. They are necessary for special needs kids, but they benefit all kids.
Thank you so much, ma'am. Now, there's a participant who wants to know your opinion on the integration of entrepreneurship elements in the curriculum to prepare them for job transition, especially in the higher grades. How helpful would that be?
That is a wonderful suggestion. In fact, I think I know in India at least, the new education policy which has just come out recently, the policy document has come out, and it does incorporate a lot of these elements. In fact, after the primary onwards, they can even have a wider choice of subject options. So if that again could lead to possible vocations later on. And when they come into high school also, these kind of curriculum transitions are being planned in the policy document. So I'm hoping, yeah, that is what is required, greater flexibility. Some of the countries are already doing it. I think Finland, Sweden, some of these Scandinavian countries, they've already overhauled their regular education system in this fashion. Therefore, because of that UDL approach, every child, not just children with special needs, every child gets an idea about what their strengths and weaknesses are, and which area they would like to diversify into while they move through the schooling years. So yeah, definitely that will help, and more so for our children, because with our children we need to plan ahead.
Thank you for your inputs, ma'am. We'll take the last question of the day. That is a case-specific question where Sampada Tivaskar wants to know that she has a student in her class and he is in second grade. He understands things, but he's not able to speak clearly and has poor attention span. How can she, as a teacher, help improve his speech or also make him more attentive and focused during the lessons?
Can you just repeat the question again, please?
Sure, ma'am. So she wants to know that she has a student in grade 2 who understands everything but is not able to speak clearly, and the child has poor attention span. How can she, as a teacher, help this child to have a better attention span and also improve his speech?
Okay. What first thing I would ask is, have the parents taken the child for an assessment? Are the parents aware the child is having difficulties? So, since the educator is aware the child is having difficulties, convey that to the parents. Ask them to take the child for an assessment. If there are speech and language issues, probably you may need input from a speech and language therapist. Um, if the child is verbal, you may need a speech and language therapist to help you with, how to improve speech clarity, pronunciation issues, and so on. There are specific techniques they use. So, you can collaborate with those professionals. The other thing is, one of the basic rudimentary things is, if they are not speaking and if the pronunciation is not right, normally we show them how that sound is produced and we give them practice words with these sounds. I'm not going to great detail because I do have some knowledge of speech and language therapists, but a therapist, a proper trained speech and language therapist will be able to give you more ideas and inputs on this. Also, the attention part of it, what we normally do with children who have short attention spans is start off with what their present attention span is. So plan your activities accordingly, that duration, and give little mini breaks in between. So, and then when you change over also, try to give different activities, because when they have short attention span, if you give a writing activity, give a break and then again give a writing activity, that can also, they get bored easily. So what you can do is, after a writing activity, probably you can move on to a hands-on interactive lesson or an interactive activity. Or if you're going to, go to two written activities, say in a higher class, maybe give a little break, such as, go drink some water or walk around the classroom or take a walk in the corridor. Basically, a lengthy activity needs to be broken into smaller installments, and mini breaks need to be provided. And if because the child is in grade 2, I would suggest go for different kinds of activities. You can stay on the same topic. So if you're teaching numbers, you can do numbers using counters. So that is one activity. Then move on to a worksheet using numbers. So you're still on the number concept, but you're doing a different activity. So that keeps up the attention span when you're changing and varying the activities. And understand that they have their limitations. So you need to give breaks in between.
Thank you so much, ma'am, for sharing these activities. Hope they would be useful for the participant. Now, I take this opportunity to thank you for sharing your knowledge with our community members and also patiently answering these questions with your insights. Dear participants, the feedback link is posted in the chat box. Please do provide your feedback to us. Now, I would ask Geetha ma'am to share her experience of the event.
As usual, I don't have to say I've been a regular on the Ability platform. So, thank you for providing me with this platform. And with whatever experience I've gained over the years, still gaining and learning a lot with regard to every child presents a new opportunity. So, my learning process is continuing. So whatever I've learned so far and I'm continuing to learn, I'm only glad to share it with the participants. And thank you to all the participants as well for sitting through this long session. There was a lot of theoretical input in this particular session, but so I know it is difficult. Even a person like me, I have problems sitting for so long, attention issues again. So thank you so much for being so patient and being wonderful listeners. And thank you, Ability, once again. Looking forward to more sessions. Thank you.
Thank you so much, ma'am. The chat box is filled with gratitude for your session and the attendees have enjoyed every bit of it. Now, The links for the upcoming sessions will be posted in the chat box. You can sign up and we shall see you in the upcoming sessions. For now, a big bye from Team Ability. Wish you all a good day ahead.